Let's go back to our earlier story where the Association of Health Service Administrators Ghana is lamenting the adverse effects of the current economic crisis on their operations to be able to stay in business. The association is calling for an interim NHIS tariff dispensation and immediate reimbursement of outstanding claims to avert imminent shortage of medical commodities and the possible collapse of healthcare facilities in the country. Now, in a press statement released after an annual general meeting held in Takoradi last week, the association cites that rising inflation, high fuel cost and exchange rate depreciation as the reason for the astronomical increase in cost of health commodities and other imports for quality healthcare delivery. Now, they've been making quite a number of demands. So joining me for this conversation is Abulai Yaro Haruna, who's the Public Relations Officer of the Association of Health Service Administrations Ghana. Good morning, sir, and many thanks for your time.
Yeah, good morning, and good morning to your viewers.
Now, can you give us more insight regarding the change in the cost of health service delivery from then and now, for which you are demanding an immediate disbursement of NHIS claims?
Well, thank you for the opportunity. In recent times, the health sector, particularly managers of health institutions, have been faced with very astronomical increase in prices of particularly medicines and non-medicine consumables, And it has also been exacerbated by the fact that because of the situation in the country, most of our private suppliers who supply these medicines and non-medicine consumables to us also find it difficult to be able to give us credit facilities. So they usually will demand for payment on delivery for these medicines and non-medicine consumables. And because we've also not been reimbursed regularly by the NHIS for services that we've rendered to their clients, it becomes very difficult for us to be able to meet the demands of the suppliers of our medicines or non-medicine consumables so that we keep hospitals running at optimum. So it's really a difficult situation for managers of healthcare institutions at the moment.
But how much on average are the members of the association owed by the NHIS?
I think as we speak, although it may vary depending on facility by facility, I know some facilities have been reimbursed up to March 2022. Others have also been reimbursed up to February 2022. I am not aware of any facility that has been reimbursed from April up to date. So you can do the math yourself and you will know the number of months in arrears.
And how has the claiming process been for members? What's the current situation? Any update on this?
I didn't get that across.
So how has the claiming process been for members, and what's the current situation?
The claiming process?
Yes. For the funds?
The submission of claims to NHIS?
Yeah.
Or in terms of claims submission, with the introduction of the online system of submitting claims to NHIS, that is the Claimit, that has actually improved the speed at which we submit our claims. Unlike previously, whereby we submit claims manually to the CPC, that is the Claims Processing Center. Now we do it online through the Claimit software that the NHIS has deployed. So at the end of the month, within a couple of days, maximum 2 weeks, we are able to submit our claims for the previous month in the ensuing month.
Okay, and how does this affect your operations?
How does the submission of claims?
Yeah,
want to know how the non-reimbursement is affecting
your operations, yeah.
Yes, very well. That is what I just made in my earlier submission. Because we are not reimbursed regularly, it's difficult for us to be able to get our consumables. And these consumables are the inputs that we need to be able to render service to our clients who visit our facilities. You can talk of medicines, gloves, gauze, cotton wool, and all the basic inputs that is used in rendering service to you when you visit any health care facility in Ghana. So we need to get all these things to be able to run our facilities. And because we are not reimbursed regularly, and the suppliers also demand for payment on delivery, because they also cite the situation whereby, because of the current situation that we have, it's difficult for them to be able to offer us credit facilities. So most health institutions now, if you actually speak with them, you realize that on a daily basis, what we do is some kind of firefighting to be able to remain in operation. No matter how proactive you are, it's difficult.
But now, you are service providers. How do you make sure that the quality of service delivered is not compromised? We understand you have the challenge, but you need to make sure that you deliver the service.
Yes, so that is why we did indicate in our communique, that the situation is having a negative impact on the service delivery in our healthcare institutions. And we have made some proposals, which when the NHIS takes on board, we think that in the interim, if we have some kind of allowance for the tariffs, and the other challenge also has to do with how these tariffs have not been reviewed regularly. Because you find a situation whereby you expect that once economic indicators are varying, then the tariffs should also be varied to be commensurate with the indicators. But unfortunately, that is not the situation that we find ourselves. So if the NHI is able to put all these recommendations in place, we think that it can bring about some improvement in the claims reimbursement situation.
Mr. Haruna, thank you so much for your time. And that is Abulai Yara Haruna, who's the PRO for the Association of Health Service Administrators Ghana. And you're still watching Joy News Desk.